Well, good morning, everyone. My name is Dr. Pulkit Nag. I'm working as a medical oncologist at Apex Hospital, Malvinagar, Jaipur. So today I'm going to speak on a very important topic which is playing a significant role in the current era of oncology, that is immunotherapy. So what basically immunotherapy is? Immunotherapy is something which enhances the body's own immune system to fight against the cancer cells. So in our body, we have a natural immune cells by the name of T cells, and we have cancer cells which act as a foreign antigen to our body. So basically the function of immunotherapy is to enhance the function of T cells so that it becomes more powerful and fight against the cancer cells. Now how does it happen? So on the T cells we have a receptor by the name of PD-1, that is program death 1, and on cancer cells we have another receptor which we call as PDL1, that is program death ligand 1. So whenever a cancer cell enters the body, our T cells tries to detect the cancer cells, but due to some immune suppression, the T cells are not able to detect the cancer cells. Now, how does it happen? So whenever cancer cells enter the body, the PDL1 receptor on the cancer cells interact with the PD1 receptor on the T cells. As you can clearly see, this is T cell with PD1 receptor and this is cancer cell with PDL1 receptor. So whenever there is no immunotherapy given and this interaction happens, so you can see that the cancer cell size increases and the T cell size decreases. It means the capacity of the T cells to fight against the cancer cells decreases because there is the inhibitory signals that happen due to interaction between the PD1 and PDL1, and so that the cancer cells replicates in our body leading to cancer. Now what is immunotherapy? So immunotherapy basically is either anti-PD1 or anti-PDL1. We can clearly see whenever we add any anti-PDL1 immunotherapy, we can see that it blocks that inhibitory signals and the cancer cell size reduce, and there is a proliferation of T cells which secretes lots of other enzymes leading to killing of the cancer cells and finally helping our body. So this is the recent advancement in oncology we have. Now how immunotherapy is different from chemotherapy, which is a common word among all the patients and general population. Chemotherapy has a lot of side effects like weight loss, hair loss, lot of nausea, vomiting, and other side effects. Although immunotherapy is relatively safer, we require lesser pre-medications to use of immunotherapy. So that's why it works much better, and although the tolerability and safety profile is far better than chemotherapy, that's why immunotherapy given for a longer time. So in our body, there are two major cancers in which immunotherapy plays a significant role. One is the kidney cancer and one is the skin cancer by the name of melanoma. So in both these cancers, naturally there are more number of immune cells. So basically there is no role of immunotherapy. There is major role of immunotherapy in both these cancers. Immunotherapy majorly works in stage 3 and stage 4 cancers, in most of the other cancers also. Like in lung cancer, like in stomach cancer, like in esophageal cancer, various other cancers, almost all the cancers in the body, immunotherapy has played a major role. Also, sometimes on the basis on histopathology, we do a PD1 receptor testing to show how much is the PD1 percentage in that particular cancers, which helps us decide that how much immunotherapy and what immunotherapy should be given or should not be given. So I'm very hopeful that with the help of this video, all the patients and all the audience will be aware regarding the role of immunotherapy and any other further assistance required. I think we should always consult a dedicated medical oncologist regarding the further role of immunotherapy in the cancer.